You might be knowing one name or the second name, but the ischemic heart disease, or in short, it is written ISD, or myocardial infarction, in short, it is written MI, or unstable angina. These are all for common man. It is one and the same as the case of heart attack or acute coronary disease. Now, what happens in this? There is a less blood flowing through the coronary arteries, which are supplying blood to the heart. Heart also requires blood for functioning. If it gets less blood, then there's a problem. Now, it occurs due to some kind of block into the coronary artery. Now, what are the common causes of this acute coronary disease? The first is most important and contributing major chunk of causes is the mental stress. Second is atherosclerosis, cholesterol deposition, then hypertension, or we call it the high blood pressure, then hereditary, obesity, smoking and drinking habits, sedentary job leading to lack of physical exercise, and side effects of modern luxurious life, and emotions. These are all the causes of acute coronary syndrome or heart attack. We'll take one by one, but here if you see, I have put this mental stress in highlighted red. Why? Because it is the most common. Now, 21st century is called a century of tension, stress. When there is a mental tension, the body, human body, gets affected because of the tension, and there are psychosomatic changes. If the mind is stable, there is no irritation. Respiration is normal, pulse rate is normal, heart rate is normal. But when mind is disturbed because of some stress or something which is happening against your wish, then there is irritation. Because of the irritability, there is a change in the respiratory rate, pulse rate changes, and then we find the results as increasing acidity and disease arrival like heart attack, which is called as lifestyle disorder. Because you must be knowing malaria is caused by some organism, typhoid is caused by some organism, but heart attack is not caused by any organism. So it is because of mental stress. That is why we call it as a lifestyle disorder. When all the systems are functioning normally, so the physiology of the body is normal, then we are healthy, all the systems are functioning properly. But when this physiology leads to pathology, means abnormal functioning or resulting in the disease, which may be due to inborn defects, organisms, bacteria, virus, or stress. Now, heart attack is not caused by inborn defects or organism, but it is because of the stress and because of the adaptation of the wrong habits, which we say that because of the modernization, we are getting it. So this is a lifestyle disorder. Now, can we treat mental stress with medicine? Answer is no. But can we treat mental stress without medicine? Yes. And that is why by yoga, and that is the importance of the yoga. Currently, everybody is facing stress. More and more modernization, you will find more stress. If you see the Western world, they have got more stress and they have got more psychosomatic disorders, psychiatric disorders. In 21st century, we have forgotten the holistic approach of yoga. We have fragmented our object, the human being, in multiple pieces, the patient in multiple pieces, and each piece is treated by a separate specialist without knowing what is happening with the other piece. That is what we do in the modern medicine. And that is why we cannot give a complete cure. But yoga has got a holistic approach, which if somebody practices, it will keep all the systems in your body working efficiently and you will not get any disease. Now, just coming to the heart attack or acute coronary disease, first we should know a little basic about the heart. This is the heart. The size of the heart is said to be just a closed fist of everybody. That will be the size of the heart, which is situated on the left side of the chest, above the diaphragm. Now, this is the vena cava, which is collecting all impure blood from all our body, and it comes here. And this is the aorta, which carries the pure blood. And these are the coronary arteries. These coronary arteries, they supply blood to the heart. Now, if you can see from inside, this is the inferior vena cava, which collects the blood from all our body below the umbilicus or below the diaphragm and sends it to the heart. And this is the superior vena cava, which collects the impure blood from all our body above the heart. And this blood comes over here, and then it comes to this chamber. From here, it is pumped through these two vessels to the lungs for purification. And after purification, it comes over here. Then it comes to the left ventricle, and from where it is pumped through this aorta to whole of the body. So all the organs in the body, they function properly. Now this pump, if it is functioning properly, then the distal part of the body, like this part, this part, this part, or this part will get better blood supply. If heart is not functioning properly, what will happen? The part which is far away from the heart will not get proper blood supply, and then there will be some disease. So to avoid this, what should be the ideal thing? The heart should function properly. Now, for proper functioning of the heart, as all the organs of the body requires blood for functioning, similarly, heart also requires blood for its proper functioning. Now, from where it gets? It gets through these coronary arteries. These are the coronary arteries which supply blood to the heart, and they give all the nutrients, oxygen, and that is how the heart is functioning. Now, if there is any blockage into this artery, what will happen? Suppose this artery is blocked, then this part has become totally black. What we say? The heart has become, this part has become totally dead, and we say he has got a heart attack. This patient is then admitted in the hospital in ICU. He is given acute treatment, and after 8-10 days is discharged. Now, what are the causes of myocardial infarction? Why these blocks occur? Now, this may be because of the spasm of the artery, means the tremors of the artery, या थरथराट जो होता है artery में, that is why the spasm. Then second is the thrombosis. When there is a cholesterol deposition, the atherosclerotic plaque is formed and it forms a thrombus. And if it gets detached from this place, then it goes to other part, and that is called thromboembolism. So it may be because of spasm, maybe thrombosis, maybe embolism. These are the causes of myocardial infarction. Now, what are the symptoms usually find? Patient will have severe chest pain. You can see here that he has got a very severe chest pain. He cannot bear it. See the face. He feels that as if he is getting strangled by somebody. Choking sensation is there. He feels that somebody is squeezing inside the chest. Heaviness of the chest is there. Pressure is there. He feels very tightness into the chest and very unbearable pain. Usually patient will tell, I had a pain in the past also, but this pain was, I never experienced this type of pain. Such a severe strangling type, choking type pain is there. What are the usual symptoms? Patient will have restlessness. He will be not able to sit quietly. Pallor on the face will be pale. Profuse sweating, he might have lot of sweating all over the body. If you try to hold his hand, you will find that the extremities are cold. He might be having breathlessness. If you check the pulse, it may be rapid. Then apex bit, you may not be able to feel, but it is felt over the chest. Heart sounds with distant gallop rhythm will be there. And on auscultation, we will find rals and wrong kai. The blood pressure may be normal or might have gone down or might have dropped. So these are the usual symptoms of the heart attack. Now, what are the causes? As I told you initially, few causes. But this can be divided into modifiable risk factor and non-modifiable risk factors. Now, what are the modifiable risk factors? First, we can see diet. We have got the wrong belief that to get lot of, I should become strong, so I should eat lot. It's not like that. If you eat more, you face more problems. So, and that too also, if you are eating a lot of oily, fried food, then this gets converted into fat, and the cholesterol is, when it runs through the vessels, it gets deposited. Now you can see this is the artery. And the normal aperture of the artery is this much. But because of the cholesterol deposition, this has become like this. So the lumen has become narrow. When this still increases more, one day you will find that this artery is totally blocked. So this is because of the high cholesterol which gets deposited into the walls of the artery. Then obesity. If because of the modern lifestyle, the input is same. There is no change in our eating habits. On the contrary, we are eating more because lot of different types of foods are available by different chefs, and you try to satisfy your tongue. So your habits are increasing. But work-wise, we are working less because we have got modern amenities. When I was in school, I remember in 1964-65, I had to walk to the school at least 5 kilometers. There was no rickshaw, no cycle, no car, no scooty, nothing was there. But nowadays, even across the road school, just a half a furlong also, the child wants to go by car. Then even normally...
Bucket नहीं करे तो वैसे नहीं होता.
पण वियांदा तर शावर नहीं करतो.
तो वैसे करतो. They are bad बात.
म्यूट करिए जरा, प्लीज म्यूट. So the activity has reduced. So energy expenditure has gone down. So input is same, energy output is less. So what is happening? The extra calories which should have been burned by activity, they are deposited in the body in the form of fat. And they can get converted into the fat, and they are deposited at different parts of the body. Now heart has to work more to supply blood to this extra weight of the body. And that is why sometimes heart gets tired. This is obesity. Then coming to the blood pressure, hypertension. Because of the stress, nowadays, hurry, worry, and curry, blood pressure is increasing. I used to conduct medical camps in different strata of the society. When I was conducting classes in corporate sector, I found that the staff between the age of 30 to 40, 50% of the staff, I found they are having high blood pressure. Why? Because of the corporate activity, because of the hurry, worry, and curry, target achieving tension. So that is why they have got blood pressure. And if this blood pressure remains high, then it may lead to heart attack. Then coming to the smoking. Smoking, the nicotine which is there into the tobacco is one of the very dangerous poison. Now this nicotine, when it goes into the circulation, it causes tremors. And because of the tremors, what will happen? The lumen of the coronary artery will reduce. If that reduces, what will happen? The blood supply to the heart will be reduced, and he may get heart attack. So smoking is one of the very dangerous things. Then physical inactivity, I just discussed about obesity. If you are not doing any type of activity, but you are eating it same, you are going to get heart attack one the other day. Stress. Now, stress is a thing which is an individual perception. Suppose some incident is there. It is not necessary that everybody will get tension or stress because of that particular incident. Some may, yeah, okay, it doesn't matter, something has happened. But some may take very severe emotional setback to that. Oh, this has happened, this is, so that is a stress. So it is a individual perception. Endocrine, the glands which are there in our body, if they are having some malfunction, again, you may get some high blood pressure or something else, and it may come to heart attack. So these are modifiable risk factors, means we can modify it. So we can stop eating oily food, we can stop eating fried food, we can avoid such things which will prevent you getting any stress or high blood pressure. You will not smoke, you will do the activity so that you can change and you can get keep yourself away from the heart attack. So these are modifiable risk factors. Now, these are the non-modifiable risk factors. Means this we cannot modify. What is the first is a hereditary. Now, this hereditary is transformed from parents to children by genes. So genes doesn't change. So this we cannot change. But it is not that 100% all the children will get heart attack if their parents have got. Most of the time it is because of our modern habits. Age. As age advances, the arteries, the vessels which are supplying pure blood, oxygenated blood, they become rigid. Their elasticity reduces. And that is why now if the vessel is elastic, when heart pumps the blood, it will flow through it without any problem, without much force. But if the pump becomes rigid, the wall becomes rigid, then to propagate the blood from the heart has to work more. And that is why blood pressure increases. That's why as age advances, you may find that blood pressure has increased. Now, can you avoid this? Aging, we cannot avoid. But by practicing yoga and practicing other lifestyle modification, you can keep the elasticity of the muscles of the vessels so that you may not get blood pressure at an early stage. Now, third is the sex. Means those who are ladies, females, they have got estrogen secretion hormone into their body till the age of menopause. Now, this estrogen acts as a cover. That is why usually ladies, they don't get heart attack before menopause. But after menopause, the estrogen secretion reduces and then they have got equal chances of getting heart attack. So these are non-modifiable. Now, what are the precipitating factors in myocardial infarction? Suppose somebody has got a heart attack and he has recovered. So after that, what usually everybody must be knowing, what we say, Arey, don't tell him anything, don't give him any stress, don't ask him like this because he's a heart patient. Why we say? We say because we don't want to pressurize him, give him some burden, give him some stress. That is why we try to say like that. So always, if this person gets stressed, then he may get one more acute heart attack and he may collapse. So we should avoid giving stress to the patient who has got a heart attack. Then strenuous work. The person usually, when he has got a heart attack, what we tell, you have to do light work. You don't have to exert yourself. So I've just shown you the example. Suppose your car is not working. So don't try to push yourself because this is a strenuous. So you may get heart attack again. Then exposure to the cold. The person who has got a heart attack, usually they should not go to the high-rise areas like mountaineer area or Leh, Ladakh like that, where there is a extreme cold. Because of the cold, the vessels, they constrict and the blood supply to the part is reduced. Another most important thing after heart attack, the patient should not take very heavy meals. The reason being, when you take heavy meal, the intestines, they have to digest the food. So more blood is diverted to the intestines. Now, suppose patient has got heart attack. So he's because of some blockages. So his heart is already jeopardized. He's getting less blood supply. And after heavy meals, what will happen? Some still more blood has gone to the intestine. So heart will get less blood supply. And sometimes it has been seen that a patient of heart attack, he has recovered, gone home, is moving around, and after 1 or 2 months, he thinks that I have become totally all right. And so what he does, he lavishes with the heavy meals and all sweets and all that. And at the end, we find sometimes that after lunch, after dinner, we found that patient collapsed and died. Why this happens? Because more blood has been diverted to the intestine because you have taken a very heavy meal. So all these things you should avoid. So these are the precipitating factors. Now, what are the complications of heart attack? First is a thromboembolism. Means now suppose there is a block over here because of the atherosclerotic plaque, and that block, if it gets detached from here, it will travel through this artery to other parts of the body. It may go to the brain, patient may get stroke, paralysis. It goes to the retina, he may get difficulty in vision, may not be able to see. Then if it goes to the other parts of the heart, ventricular septal rupture, the heart may rupture like this, or here cardiac rupture and ventricular aneurysm. This is the ventricular aneurysm. Because of this, wall has become big and there it has excavated the area and it has formed the aneurysm. So these are the complications which lead to the death finally. So you should avoid or arrest the progress of disease so that you will not get these complications. Now, what are the investigations done in heart attack? Well, first, everybody must be knowing ECG, electrocardiogram, where we see the tracing of the heart and decide whether he has got a heart attack or not. Then second is a 2D echocardiography. Here we see what is the functioning of the heart, what is the ejection factor of the heart, whether heart has become quite weak or something like that. Then serum cholesterol. I told you, if you are eating a lot of cholesterol and oily food, you are likely to have more cholesterol, and it will be seen in the blood test, serum cholesterol, lipid profile also. Then we come to the stress test. Treadmill test, we ask the person to run on that belt and see whether he is able to run. We measure the speed and see the heart rate also. And that way we can say whether it's stress test positive or negative. If stress test is positive, then we ask to do angiography. Angiography is the report or is the investigation which will tell us whether there is any blockage into the artery. Now, this is the angiography picture. What we do, we inject a dye, radiopaque dye, through the artery, either through the groin or from the hand, and inject the dye. And when it reaches the heart, we take the X-ray picture, and then we can see the artery. See, this dye is opaque, so you can see the coronary artery, which was seen in the previous picture. And here you can see the block. Now, this block is causing the problem, and that is why patient gets heart attack. Now, heart attack is an acute stage, so needs allopathy treatment to tide over the crisis. In one of my lectures about the principles of yoga as therapy, I always give the emphasis on this point that any acute condition cannot be treated anything other than allopathy, but only by allopathy, because it has to be treated immediately to tide over the crisis. No pathy works except allopathy. So acute stage, there is no alternative. But once the acute stage is gone, suppose patient was admitted in the hospital, 8-10 days he was kept over there, then discharged, and then he has come home. Now it is recovering, convalescing. Then you can think of giving yogic practices. but not because so many times it has been observed that some people say anything and everything under the sun can be cured with the help of yoga. But it is not like that, because acute stage, there are quite a number of conditions, about 10, 15 conditions, which are termed as acute conditions. All these acute conditions, they require allopathic treatment. So similarly, heart attack is one of the acute conditions. So it needs allopathic treatment first, and then you can think of it. Now, usually after what is done, once he is diagnosed, he is admitted in the hospital. It is not in the plain ward, but it is into the ICCU, intensive cardiac care unit, where heart is monitored, all the pulse rate, blood pressure are monitored, and all supportive treatment is there. So that patient, because of the heart attack, his heart is not working properly, it is weak. So there, patient has to be given total bed rest, and that is why he is admitted like this. And then once he is discharged, in allopathy, what we do angioplasty, either stent angioplasty, plain angioplasty, balloon angioplasty. So here you can see the balloon is introduced. This balloon is introduced over here, and it remains over there in an inflated position. So the lumen which has become small, you can see the lumen has become small. Because of the inflated balloon, it has become distended, and blood is passing through this properly. Or nowadays we are using medicated stent. And if person has got multiple blockages, then in allopathy, they do coronary bypass surgery. So suppose here is the block, they take a graft from some other part of the body and then put it over there. So there's a diversion of the channel. So these are the modern allopathic treatments for heart attack. Now, I have treated about 1800 patients of heart attack with the help of yogic practices. I'm just showing some of the data. This is the data of 1341 patients. Now, why I'm showing this? I have given you the age group. I have seen 4 patients in the group of 15 to 20. 21 to 30, 17. Maximum were in 31 to 40 and 41 to 50. Now, above 60 also we found. Even I think last month or last year also we read in the paper, one of the young CEO of one of the corporate sector, he died because of heart attack. Now, why this happens? Age of 40 and 50 is not age of the dying age, but it is because of they are exposed to so many things. That is why they are facing it. And about 20, 30, 40 years back, heart attack was supposed to be occurring after the age of 50, 60. But here you can see we found cases between the age of 15 and 20. So no age is bar, and all the age group, maximum is between the 40 to 60, we find maximum number of cases. Now we have given yoga practices to them. So this is the data of 940 people, and after practicing yoga for 3 months, we asked them, how do you feel? So 25% relief was quoted by 321 people out of 940. 398 people, they said we got 50% relief. And 179 people, they said we got 75% relief. So total out of 940, 34% people have got 25% relief. 42% people have got 50% relief. 18% people have got 75% relief, and like that. Now, once I had a workshop, all these people, and I called all of them. So 125 people attended. So this is the data of the 125 people. 82% people, they were stress positive. 66% people, they have done angiography and they are having blockages. And then I gave them questionnaire that where you did class about 2 years back, 3 years back, 4 years back, 5 years back. So what was your percentage of relief at the time you did the class? So that time they said about 44 people, they said 25% relief. 38 people said 50% relief. 26 people said 75% relief. And 13 people, they said they have got more than 75% relief. And only 4 people, they said indeterminate. We cannot tell whether we were benefited or not benefited. Then what I did, the next survey was, then I asked them, as on today, how you are feeling. Because you have done class 1 year back, 2 years, 3 years, 4 years back. How you feel today? So then I also asked them another question, whether you are practicing regularly or doing sometimes. So the people who are practicing regularly, 11 people, they said 25% relief, 28 people, they said 50% relief, 26 people, they said 75% relief, and 30 people, they said they have got more than 75% relief. But the people who are not practicing regularly, they are just doing sometimes, there you can see 2 people, they said 25% relief, 16 people, they said 50% relief, 7 people, they said 75% relief, and 5 only got more than 75% relief. And in that, 1 person had undergone angioplasty and 1 person had undergone bypass surgery. So if you see to these figures, you can definitely say, if you practice yoga regularly, you can bypass the bypass surgery also. Now, these are the few of the reports of my patients who have done yogic practices with us. This is one of the patients. This is the angiographic picture. This is one coronary artery, and this is another coronary artery, and this is one block from here to here, and this is another block. Now, this gentleman, they did yoga practices with us, and you can see the date, 1995, May 95, and after 1 year, in June 96, he has repeated his angiography, and the block which was from here to here, only this much remained, and this block which was here, it has totally vanished. And this person has never undergone bypass surgery. Similarly, this patient was there who was having this single block, and he was advised to undergo balloon angioplasty. You can see the date 2001, and after 1.5 years, he again did angiography and found that block which was here, this block, it has totally vanished here. So if you practice yoga regularly, you can keep yourself away from the heart. Now, what are the effects of yoga on human body? At physical level, it improves the blood circulation, oxygenation, improvement in the elasticity of the muscles by asanas. This will improve functioning of all systems. And at mental level, it changes your attitude towards any event or incident. So this is the benefit of practicing yoga regularly. Now, how can you use yoga as therapy in coronary artery patient disease? Now, for this, we'll just see how can we do it. So it can be used as a preventive, curative, adjuvant, and palliative. Now, in what condition we can use it as a preventive, that we'll see. Now, yoga is a 5,000-year-old science, and if you practice it, it will set the biological clock of your body in such a way that it will not go wrong. And if something happens, you can add some more kriyas, so which will help to keep yourself healthy. Now, sages, Rishi Muni jo the, they are practicing yoga in the Himalayas, and they are not practicing it for, they are practicing it for moksha. Now, modern person is not interested in moksha. He is interested in taking maximum benefit of the modern amenities. Now, currently also, when people are practicing yoga, some people, they are trying to tease them that, oh, what you are doing yoga? Kya fus-fus karte ho? Usse kuch hota hai kya? But then we find sometimes he asks him, Arey, this year end you have not taken any leave. You never fall sick or what? He said, no, I never fall sick. That's why I have not taken any sick leave or casual leave or anything like that. So he asked, what do you do? कौन सी चक्की का आटा खाता है? बोलता हूँ जो आप लोग खाते वही मैं खाता हूँ. Then what do you do? Then he say, I do yoga. Oh, you do yoga. That is why you are healthy. Okay. Then let us practice yoga because we want to enjoy the life. That's why modern person is practicing yoga, not because is interested in moksha, but he is interested in taking benefit of all modern amenities and fancy things. Yoga has got a preventive aspect. Now, how we can use it as a preventive, on that I'll just give few guidelines. Yoga, if you practice regularly, you can keep yourself healthy. Now, if you go to medical college, there are different departments: surgery, medicine, gynecology, pediatrics. The patients of that diseases, they come to that particular department and they are diagnosed and they are treated. There is one more department in medical college that is called preventive and social medicine, or nowadays it's called community medicine. Now, what is the function of this department? They try to find out the cause of the disease and treat it. What is the principle of their department? Prevention is better than cure. रोग का सबसे अच्छा इलाज क्या है? तो रोग होने न दे, यही सबसे अच्छा इलाज है. तो ऐसे रोग प्रतिबंधक तत्व के ऊपर मॉडर्न मेडिसिन का एक डिपार्टमेंट काम करता है. उसी तत्व के ऊपर ये हमारा योग का अभ्यास है. वन मोर एग्जांपल आई गिव. This is a hilltop. People go for picnic over there, and if somebody falls down from here, we have erected a big hospital here. We have got ambulance, all instruments and specialists are there. We have spent 50 lakhs to have this hospital. Suppose you put fencing to this, it may cost 2 lakhs or something, 3 lakhs, but nobody will fall down and you will not need this 50 lakhs rupees to be spent. Now, same thing, if you practice yoga regularly, you can keep yourself healthy and you will not get any disease, maybe may not be the heart attack also. As a preventive, at physical level, it improves the blood circulation, oxygenation to all the parts of the body, and it also improves the elasticity of the muscles by asanas, which will improve the functioning of all the systems. Because in our body, in each and every part of the body, each and every part of the organ, in the wall of the organ, there are muscles. So if the muscles are elastic, the organ will function properly. And the elasticity of the muscle is maintained by the practicing different yogic practices and asanas. Then efficient functioning of the all systems of the human body will not give any disease. At psychosomatic level, because we have seen the causes of the heart attack, I have put it in the red, highlighted, mental stress. So more than 50% toll is taken by the mental stress. So we have to see how yoga can help. It will help at physical level and at mental or psychosomatic level. What will happen with that? It will improve the understanding power, will increase calmness of the mind, will reduce the severity of the reaction, improve the body awareness, comprehensive awareness about own weakness and good and bad habits, will help to reduce the ego, self-centeredness. It will also help to have the sense of satisfaction, not run after the materialistic world, and will reduce the needs. Now, all these things, they are very much positive for increasing stress, increasing the secretion of the sympathetic hormones like adrenaline and noradrenaline, and that is why the blood pressure goes up and patient gets heart attack. So all this should be kept at a low level, which is possible by yogic practices. Improve the understanding power. I always give an example of a train coming late. Suppose a train is supposed to come at 7:30 and the time is 7:30, still train doesn't arrive. So what will happen? One person will just see to the indicator, time is 7:30. He will see the watch. It's already 7:30, but train has not arrived. He said, okay, I'll just read the paper, today's newspaper, what are the news, and he will wait. Another person, he will be standing, facing the floor and muttering with himself, what, train has not yet come. It is going to get late. I will reach to my office late. What will happen? The third person, who is little more aggressive, he will start talking loudly. What is this? They cannot maintain the time. They cannot reach on time. I am going to get late in my office. If I go late, today is the third time I am going late. So they will cut my one casual leave. So my pay will be cut. My boss will say, oh, late Latif, aage, come. This motorman doesn't understand this. Who is giving them payment? We are paying them. Na? So they should work properly. So we'll start talking like this. Next person, what he will do? When he sees that the train is coming, which is already late, he will pick up one stone and throw it to the motorman's cabin. Now, incidence is one. Train is coming late. But there are 4 reactions. First person, he just saw the indicator, saw the watch, and kept on reading the paper. So there was no reaction to the action. Second person, muttering, little reaction. Third person, little more reaction. And fourth person, severe reaction, throwing the stone. Now, incidence is one, that train is coming late. But first person analyzes it. He understands that why train has not come, because train must not have got signal. Why there was no signal given by the signalman? Because the next train must not have gone ahead. So he knows that when that train will go, he will give the signal and this train will come inside. So there's no point in talking and arguing. Let us sit there. So he's sitting quietly. So this understanding power, the reaction to the action will reduce, and you will not be that upset because you have got awareness about the situation, and you will sit quiet, keep quiet, and you will not have any problem. The people who are the third and fourth category, those who are talking loudly or throwing stone to the train, usually they are irritated, they have got a high blood pressure, and they are likely candidates for heart attack. Now, as a curative, can you use yoga as a curative? In few people where suppose he got a chest pain and he was taken to the doctor and he has done the cardiogram and, oh, you have got little changes of heart attack. Good that you came on time. It's not severe, but you take care. Now, this patient who has mild attack, if he starts practicing yoga, he can arrest the progress of disease or avert the disease. So this is possible in very early stage and in very minimal changes seen in cardiogram. But mostly heart attack is an acute stage, so needs allopathic treatment. So again, I am repeating, because somebody might remember, oh, Dr. Pathak has treated 1800 patients of heart attack. So my neighbor, he got chest pain and he came to me, oh, I'm getting chest pain. So I'll tell, don't go to the hospital. Why are you spending 5,000 rupees, 10,000 rupees per day in the hospital? Sit here, I'll teach you yoga. No, yoga has got no role in acute condition. So I have put it, highlighted, and repeatedly I will be telling in the lecture also. Heart attack is acute condition, acute stage, and it needs allopathic treatment only. Mostly, yoga can be used as adjuvant therapy once heart attack is, the crisis has been tied over and patient is better and discharged home, then he can think of practicing yoga. Now, yoga therapy in coronary artery disease, how can we give, what are the principles? Time to give yoga intervention, then way of yoga implementation, and precautions during intervention. So we'll discuss one by one. Now, any name, myocardial infarction, ISD or ischemic heart disease or angina, they are all acute conditions. So they should be treated, or they must be treated by allopathic medicine only. But immediately after heart attack, till 3 months, giving full yoga module is like whipping the tired horse. घोड़ा पहले थका हुआ है, बोझा ले लेके, और फिर उसके ऊपर तुम ज्यादा बोझा रखेंगे और कोड़ा मारेंगे तो वो दौड़ेगा नहीं, वो बैठ जाएगा. So it is like whipping a tired horse. So first 3 months, there is something different. What I'll tell you. Now, immediately after discharge, what we'll do? This is very tricky question for yoga therapists. Nowadays, people have become very much aware of the thing that, oh, you can get rid by anything by doing yoga practices. So the day is discharged from the hospital and paid about 1-2 lakhs rupees bill. So he say, oh no, I must get cured now. I will start practicing yoga. The day he comes home, he will call one of the yoga teacher and he will tell, I had a heart attack yesterday, I've been discharged, and you come and teach me yoga. Now, recently I have told you that in heart attack, immediately after discharge, till 3 months, you cannot give him full yoga module. So he'll say, no, we cannot give yoga module, we will deny. This you will not do. But this is for yoga teacher, remember. Why you will not do? Because what will happen? You will keep your phone down, you will call another yoga teacher and tell him that I had little discomfort yesterday. I was admitted in the hospital and doctor said, okay, there is not much problem. And he has discharged me. So I want to learn yoga. So come and teach me yoga tomorrow. Now he has hidden the thing. This another yoga teacher doesn't know that he had a heart attack. So what will happen? He will go and teach yoga. And if he starts giving a normal yoga module for a normal person like that, then he may have more trouble. So the responsibility of the first yoga teacher is that don't deny that patient. So what you will do? You say, okay, I will come tomorrow. I will see your report and see the report. And then, okay, you can practice only this much. What? Pranadharana. That means close your eyes and watch the breath. Just do it for 5-10 minutes. And in 24 hours, anytime you are sitting idle, quiet, just close your eyes and do the Pranadharana. This you can do anytime. Then do Anulom Vilom for 5 times, Omkar 5 times, mantra chanting 5 times, and meditation or Shavasana with eye closure technique. This will be given the person who has just came from hospital, discharged yesterday because of the heart attack. You can give him this minimum yoga practices. Now, once patient has been discharged and you have given him basic things, and now about usually patient when he becomes totally ambulatory. Now you all must be knowing those family member has suffered from heart attack. When he's discharged, what is told? First 8 days, you have to take complete bed rest. You will not get down off your cot. And then after 8-10 days, what is told? Okay, now you can move around in the home. Then you can sit, you can watch TV like that. After 3 weeks or 1 month, what is told? Okay, you can go down into the building colony and just chit chat with the people and come back. Then after some days, he said, okay, now you can go on work, but don't exert. Suppose you are traveling by local, then you are advised not to travel by local. You use a cab or taxi and then go to the office. Even in office, you will not exert more. Now this person, when he's totally free, ambulatory, allowed to do the normal daily routine, that time you can introduce him giving total yoga module given for heart attack. Now till that time, you have to give more attention towards breathing technique. You don't have to give more of the asanas, because quite a number of times people think that yoga means asana. But in heart attack patient, asanas should not be given in the first 3 months. It should be started after that, and that too as per the individual capacity, not before that. Now, what are the principles of practicing yoga? Suppose you are going to give yoga practices, so you should know. Or some people, they might be not knowing the yoga practices, but join this lecture for the first time. So for them, I'm giving the guidelines that the best time to practice yoga is early morning around 4:30 a.m. 4:30 baje sabar hai, that is called Brahma Muhurta. If you practice yoga that time, you get a maximum benefit of it. And then after practicing yoga, you can take your breakfast after 40 or 45 minutes. Now, suppose it is not possible to do it early in the morning, then any other time of the day you can do, but stomach should be empty. At least suppose you have taken light lunch, you can practice after 4 hours of light lunch. Or if you have taken a heavy meal, you should at least give 6 to 7 hours, because it is the time required for the heavy meal to get digested. Now, one should not practice yoga by just reading the book or watching television or watching somebody practicing it. And one should not practice yoga without teacher's supervision. You should always practice it under the teacher's guidance. Now, merely just joining the yoga class will not have the effect. If you just register yourself to the yoga class, you will not get benefit. Once you join the class, you start practicing yoga, then those kriyas will take the charge of your body. There will be some changes, and then the doctor himself will tell when he'll check you next time, oh, you have got improved this, improved that, so you can reduce the doses like that. So important thing that patient himself or yoga therapist will not change, stop or reduce the medicines which are started by the physician. One should not try to reach, suppose you are giving yoga practices should not be given on the very first day to achieve the final stage of asanas or the final step of the breathing technique. Suppose Kapalbhati you are telling 120 times in one set. So not on the first day. You start with 20, 30 and then slowly increase. If you are giving yoga practices, yoga asanas, they should be according to his capacity and slowly, step by step, you have to introduce. If you are tired, you should not practice yoga. One starts practicing yoga slowly, the changes occur in our body, and then physician will decide, and then he may reduce the doses. So it is used as an adjuvant therapy with the allopathic medicine treatment. Now should start palliative. Now should start from the diagnosis of the disease, because suppose somebody gets heart attack, it is a very big jolt to the patient himself and the family members. So they get totally upset. So from that time only the counseling, yogic counseling started. The patient will need the physical and mental support that you can give it with the help of yoga. And if the patient becomes mentally fit, he will face the problems very efficiently, and he may not have any disturbed thing while suppose he has to undergo some surgery also, he will be able to face it properly. This yoga practices, it will improve the blood circulation and oxygenation to that part of the body, so that improves the function, building up the confidence, and it can be he can perform the daily routine thing and improving the level of pain perception. This will be possible by practicing yoga. Now, few things I'll just explain Anulom Vilom, because we are going to give more emphasis on few of the practices. Few of this is Anulom Vilom. Here we have to close the right nostril, breathe in from the left nostril, then close the left nostril without the right. Again, breathe in from the right only and close the right and breathe out with the left. Again, breathe in with the left. So this completes one circle. This you have to do 10 times. Now, procedure you might be knowing, method you might be knowing how to practice Anulom Vilom, but the silent points I will tell you that you have to practice it very slowly. The breathing in and breathing out should be very slow. There should not be jerk, and you should practice it very slowly for 10 times. If you practice it very slowly and concentrate on the breathe which is coming in and going out, your sympathetic activity will reduce and it will give a good benefit to you. Now, second is the Omkar. If you know the research done by Dr. Herbert Benson on Omkar, he said Omkar a day, keep the doctor away. So if you practice Omkar every day, you can keep yourself healthy. Now, by practicing Omkar, before that, I would like to tell you that our mind is always thinking of something. Even you also must be thinking. Now he started lecture at 8:30, but the time was not given. Only 8:30 onwards it is written. So when it will finish, I don't know. Tomorrow I got some work in the morning. If I get late in the night, then tomorrow morning I will face problem. Somebody might be thinking that I have not done homework, so I have to do that. Somebody might be thinking that I have brought lot of office work to do at home, but I could not do it. Now when I will do it? So these different thoughts must be coming to your mind. Yes or no? Anyone can raise the hand and say. If you say no, I will say you are lying. Because science says that you cannot keep your mind thoughtless for more than 6 seconds at a time. If you are awake for 16 hours, maximum 10% you can keep your mind thoughtless. So hardly 1.5 hours you can make your mind thoughtless. That too, if you try to do it. Otherwise, always you are thinking about either past or future. And when you are thinking, there is a maximum stress. Now, when you are making your mind thoughtless, it has been seen that it activates the belief system. Healing system starts functioning, and it mobilizes the body resources in such a way that body heals on its own. It has also been seen when your mind is thoughtless, when electroencephalogram EEG is done, we found that their alpha waves are generated, adrenaline secretion is at a low level, pulse rate is normal, blood pressure is normal, and patient is calm and cool. But if his stress, lot of thoughts are there, then adrenaline secretion is secreted and pulse rate goes up, heart rate goes up, and that's why he faces the problem. Now, what is belief system and healing system? In allopathy, it hasn't got any place. Suppose you fall sick, what do? You go to your regular family doctor. But if he is not there, if he has gone out of station, what do? You go to some next doctor, take the medicine, but you are not happy. After 4 or 5 days, you see that your family doctor has come back. You become very happy and you go to his clinic. Oh, sir, good morning, good morning. You have come back. Thank you, thank you. He said, oh, what happened? Oh, you are not there for last 4 or 5 days. I was not well. I went to that next doctor, but I'm not happy. Now you have come back. Now I'll become all right. This faith is belief system. And this has to be activated by practicing Omkar. One another example I will give, similar to that person has got a heart attack. He was admitted in the hospital and he comes home and his friends comes and visit him. When they are departing, what the friends say? Don't worry, make your mind firm. You will become all right. What do you mean by make your mind firm? He is thinking, sitting in this easy chair and thinking, oh, my neighbor, he had a chest pain last year. He was 48. He died after 1 month. I also got chest pain. I am 49. What will happen to me? This is bad thought. Make your mind firm means don't allow such bad thoughts to come to your mind. And this is possible by practicing Omkar. And that is the importance of the Omkar. The Gayatri chanting, or you can practice any other similar mantra of your religion. Gayatri mantra is like this. If you practice, I will just show how to chant it. This Om Bhur Bhuva Swa you have to say once, and remaining you have to chant for 10 times in Kriya Yoga. That I will take in next part. Om Bhur Bhuva. So you can see here the line up. There is a line below over here. What is the importance of this? When there is a line up here, you have to lift this word up. When there is a line below here transfer, you have to prolong this word. So I will just show you how to chant. Om Bhur Bhuva. So here I raised the word. Then Tatha Vitur Varenyam Bhargo. There is a line above the go. So Bhargo. Devasya. There is a line below de. So Devasya. Dhimahi. Dhiyo. There is a line below. So I prolong the word yo. Dhiyo. yo nak. There's a line above, so I use yo nak. Prachodayat Om Tatsha Viturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Like this, you have to chant for 10 times in Kriya Yoga. Then Bhramari. Bhramari is a bee humming. It has been found that in sinuses, these are the two sinuses over here, paranasal sinuses, frontal sinuses, maxillary sinuses, they produce nitric oxide. Now, nitric oxide is important because it kills the bacteria and virus. Now, this nitric oxide is generated into sinuses and it enters into the nose and goes through the air circulation to the lungs. So it will kill all the bacteria in the respiratory passage. So chances of getting any disease, respiratory disease, are reduced. Secondly, it is vasodilator. It dilates the vessels. So the chances of reduction in blood pressure is there. Now, if you practice Bhramari, it has been studied and monitored that humming causes 15-fold increase in the nasal nitric oxide production. So this is very important. So Bhramari is good. Then Shavasana. When you are practicing Shavasana, body relaxes. After doing asanas, if you practice Shavasana, it will give very good results because body relaxes after asanas and all muscles relaxes, particularly the coronary artery, the walls of the coronary artery muscles relax. So the diameter of the coronary artery will increase. More blood will flow through the coronary artery to the heart, and heart will get rejuvenated or refreshed by practicing 10 minutes of Shavasana. Now, what are the practices we should do in the as a yogic practices? As it comes under acute condition, allopathy treatment is needed. After discharge from the hospital, you start first only pranadharana and deep breathing, then Anulom Vilom 5 times, Omkar 5 times, and Gayatri chanting and Shavasana. Then after 3 months, once patient has recovered, he has started moving around, he's up and above, no much problem. Then you can give him few asanas, that too under the guidance of the expert yoga teacher and step by step. I'm again repeating these words, as per his capacity, step by step, and not in hurry to achieve the final position of the asanas. So here you should start with Shavasana, Ardha Halasana, Pawan Muktasana, crocodile variations, Hridaya Stambhasana. Then in prone position, Bhujangasana. In sitting, Vajrasana as per its capacity. Then Parvatasana, Gomukasana, Vakrasana, Bandukasana, Brahma Mudra. These practices where there is not much of the exertion and patient can do it comfortably, those practices are given. In standing, you can practice Tadasana and Chakrasana, and in meditative, Sukhasana and Padmasana if possible. Then in Pranayam, he has to practice Anulom Vilom 10 times, 10 rounds, Ujjayi 3 rounds, Shitalit 5 rounds, Shitakari 3 rounds, Bhramari 3 rounds. Kapalbhati for first 1 month, usually you will not give. But if you are going to give, you have to give it light Kapalbhati, means not the traditional where we do normal inhalation and forceful inhalation. So the Kapalbhati which should be practiced by heart patient is light Kapalbhati without forceful exhalation. Then Jalneti to keep the both nasal passages patent so that oxygenation will be proper. Then Lagu Lahari. This is another thing which I introduced. You can do it for 5 rounds. Then Kriya Yoga, Anulom Vilom 10 rounds, Omkar, Amen or Amen. Suppose there is some objection because of the religion, if you are not going to chant Om, you can practice Amen or Amen. Then Gayatri also similarly. If you are not comfortable with practicing Gayatri, you can use your own religion mantra, which you will practice for 10 times. And meditation, Kavaladham tradition, where we start meditation with eye closure technique. So this will be practiced, and you can keep the heart healthy. And if your if you have never had any heart attack, if you practice yoga regularly, you can keep your heart away from the heart attack. And if you had some problem, some discomfort, mild changes, or suppose you had a heart attack and you are recovered from that, you can avoid the surgery if you practice yoga under your expert yoga teacher. There are conferences of different faculties like doctors, then engineers, lawyers, everything. Similarly, in doctors, there are conferences of cardiologists. In one of the cardiology conference, it was stated, this is a report of about 2010 or 11 something, that after by the end of the 2015, the heart attack incidence will increase. There will be six-fold increase in urban area and threefold increase in heart attack in rural area. Now, because of this, death toll is increasing. The problems of heart attack are quite often seen, and if you see the statistics, you will find major toll is taken by the heart attack. Now, yoga has got importance. Modern cardiologists have stated that heart attack is increasing. WHO, the World Health Organization, they have also given a statement in year 2000 that by 2020-30, the time will come that people will die because of the different diseases at a very early age. Now, the modern science, which has told what is going to happen after 20 years, is more modern, or the yogic science, which has told what is going to happen after 400 years, is more modern, because the Kabir Surdas is the Doha I am going to quote. He has stated 400 years ago that Re mana dheeraj kyaun na dhare, Re mana dheeraj kyaun na dhare, सवत 2000 के बाद ऐसा योग परे. 2000 साल के बाद ऐसा समय आने वाला है. कैसा? पूर्व पश्चिम दक्षिण उत्तर 14 काल फिरे. सर के ऊपर मृत्यु मंडला रहेगा. 25-30 उम्र के लोग डायबिटीज, ब्लड प्रेशर, हार्ट अटैक, इसके वजह से मरेंगे. सावधान. सुनने वाला हैरान हो गया. उसको लगा यदि ऐसा होगा तो पृथ्वी के ऊपर हाहाकार मच जाएगा. कभी सूरदास बेचारे अंधे थे, लेकिन उनको 400 साल के बाद क्या होना है उसका पता था. उन्होंने कहा काल व्याल से वही बचेगा जो सोहम का ध्यान करेगा, सांस की रफ्तार को नियंत्रित करेगा. ये है हरि की लीला, टाले नहीं टले, ये तो होने वाला है. लेकिन यदि हमें उससे बचना है तो हमें योग का अभ्यास करना है. इसीलिए try to understand the importance of the yoga and try to practice it. Now, I have told that it is mostly because of the tension, as the 21st century is called century of tension. Now, what are the reasons of tension? So I just got this quoting somewhere. I'm just showing it to you. The moment you are in tension, you will lose your attention. If you lose your attention, you will be irritable. There will be confusion. And if you're confused, irritated, if somebody comes and meets you, you will say, oh, no, don't talk now. I'm irritated. So you will lose your personal relation. Ultimately, nobody will cooperate you. And the things will become worse, more complications. And then your BP may rise. And you may have to take medication. You may have to take some medicine for blood pressure. Why not try to understand the situation and try to think about the solution? Many problems will be solved by discussion, which will work out better in your profession. Don't think it is my free suggestion. It is only for your prevention. If you understand my intention, you will never come under tension. If you don't come under tension, you are less likely to get any heart attack. Now, what is the best treatment for heart attack? The best treatment for heart attack is don't take anything to the heart. I'll just give one story of Buddha Dev. He used to ask at 5 homes, beg for that food. And whatever you will get in 5 homes, he will only survive on that. 5 घर में वो भिक्षा मांगते थे और जितना मिलेगा उसके ऊपर वो गुजारा करते थे. तो पहले घर गए, उन्होंने बोला भिक्षान दे, ओम भिक्षान दे. उनको कुछ भिक्षा मिल गई. फिर हो गए दूसरे घर, वहां पे कुछ मिली. फिर तीसरे घर गए तो जरा घर धनिक का था, तो उनको लगा अभी यहाँ तो बहुत मिल जाएगा, तो अभी आगे जाने की जरूरत नहीं पड़ेगी. उन्होंने कहा ओम भिक्षान दे. वो जो अमीर था उसने देखा, दौड़ के बाहर आया, क्या है? क्या चाहिए तुमको? हाँ, भिक्षा मांगते हो? काम धंधा नहीं है क्या? इतने तो अच्छे हो, शायद तुम्हारी काम कर सकते हो, फिर काम क्यों नहीं करते हो? फुकट का खाना चाहिए। हम दिन भर पसीना बहाते हैं, काम करते हैं, कुछ नहीं देता, जाओ। तो बेचारे ओम भिक्षान दे करके आगे चले जाते हैं। उतने में क्या होता है, वो अमीर की जो वाइफ होती है वो देखती है, अरे बाप रे क्या गया साधु महाराज को, इन्होंने ऐसा ऐसा गलत बोल दिया। वो दौड़ के पीछे से आते बोलते, महाराज रुको, मैं आपको सीधा ला के देती हूँ। वो कुछ ला के देती है, वो ओम भिक्षान दे बोलते ले लेते। तब से क्या अमीर आदमी सोचता है, अरे क्या हो गया, मैं कुछ गलत तो नहीं किया, ये सही में साधु महाराज हो गए और इनकी पावर होगी, और यदि उन्होंने मुझे शाप दिया तो मेरा सब ऐश्वर्य वैभव सब चला जाएगा। ठीक है, जाने दो, मैं कुछ तो दे देगा। वो जाते हैं, वो साधु महाराज को बुलाते, महाराज महाराज जरा इधर आइए। बुद्धदेव वापस आते, ओम भिक्षान दे बोलते। बोलते रुको। वो अंदर जाता है, एक सेब की टोकरी लेके आता है, सफरचंद एक टोकरी में लेके आता है और उनको देने लगता है। तो देते देते रुक जाता है, कहता है माफ करना, मैं थोड़ा आपको बहुत बुरा भला बोला, आपको गुस्सा तो नहीं आया ना? तो साधु महाराज बोलते, अभी आप क्या कर रहे हैं? तो आमिर आदमी कहता है कि मैं अभी आपको सेब दे रहा हूँ, तो सफरचंद दे रहा हूँ। बोले यदि मैंने उसका स्वीकार नहीं किया तो कहाँ रहेंगे? तो आमिर कहता है कि मेरे हाथ में रहेंगे। बोले उसी प्रकार जब आपने मुझे गाली गलौज किया तो मैं उसका स्वीकार नहीं किया, मेरे दिल तक नहीं उसको लेके गया। आई डेंट टेक इट टू द हार्ट एट ऑल, इसलिए मुझे तकलीफ नहीं हुई। तकलीफ किसको हो गई? वो आमिर को हो गई। उसका खून खौल गया, क्या करते हो, काम नहीं करते, ऐसा नहीं करते, हम काम करते थे, दिन भर सस्ते करते, हाँ पसीना बहाते हैं और आपको फुकट में चने देते। खून किसका बॉयल हुआ? आमिर का हुआ। ब्लड प्रेशर किसका बढ़ गया? आमिर आदमी का बढ़ गया। इसलिए व्हाट इज द बेस्ट ट्रीटमेंट फॉर हार्ट अटैक? डोंट टेक एनीथिंग टू द हार्ट, एंड दैट इज द बेस्ट ट्रीटमेंट फॉर हार्ट अटैक। अभी आप कहोगे कि इतना सब बताया, सच में क्या ब्लॉकेज जाते हैं क्या? जो एंजियोग्राफी मैंने आपको दिखाई तो उसमें क्या होता होगा, तो ये मैं आपको समझाने की कोशिश करूंगा। ये हार्ट का ब्लड सर्कुलेशन है, जो आर्टरी और वेन है जो खून का सप्लाई करती है, इतनी असंख्य बड़ी तादाद में ब्लड का सप्लाई करते हैं। यू कैन सी हाउ मच blood supply here, multiple vessels, very very tiny vessels. You can see how big arcade is there. Now suppose this artery gets blocked, which is seen on angiography. What happens? By practicing yoga, the collateral circulation opens up. यदि आप ट्रैवल कर रहे, यदि मेन रोड पे आप जा रहे थे और तो ट्रैफिक जाम हो गए, तो ट्रैफिक हवलदार क्या कहता है? पीछे आता है, वो बोलता है कि वो पीछे के रोड से चले जाइए आप, तो थोड़ा डीकंजेशन हो जाएगा, ट्रैफिक ठीक हो जाएगी। तो वो बाजू का जो रास्ता है जो रोज यूज में नहीं रहता था, वहां पे वो पूरी ट्रैफिक डाइवर्ट कर देता है। उसी प्रकार इफ यू स्टार्ट प्रैक्टिसिंग योगा, ये जो ब्लॉक हो गई थी तो ये आर्टरी इसका काम ले लेती है, एंड स्लोली इट बिकम्स बिग इन साइज and supplies blood to this part of the body. When second time angiography is done, that time this artery was blocked, that's why it is not seen. But this artery which has taken the size of this artery, it is seen properly, and then we say the block has gone. So that is how the collateral circulation improves and patient gets better results in heart attack because of the yoga. Now a little bit about the diet. I got this one, it is in Marathi. I will just read it for you. जिभेची टेस्ट, पोटात गेले वेस्ट, आजार बनले गेस्ट, डॉक्टर करत राहतो टेस्ट, तेव्हा आमचे रुपये होतात वेस्ट, म्हणून घराची भाजी भाकरी सगळ्यात बेस्ट. Because of your test buds, you try to satisfy your taste buds on the tongue. You visit different places, try to eat McDonald's food, this, that, and junk food. So that all goes into your stomach, and they generate the disease. And then you go to doctor keep on doing tests, so your money is wasted. So the best thing is to eat at home, whatever is prepared at home by your family member. So that is a message for keeping yourself healthy. Now, diet I told you, take sattvic ahar, then practice daily yoga and meditation. Manage stress with the help of the yoga. If you practice Omkar, Gayatri, meditation and Anulom Vilom, your reaction to the action will reduce. Your mental stress will come down. Your efficiency, your deciding power will improve. Say thanks to no smoking. If you don't smoke, the chances of getting heart attack also get reduced. And periodically keep yourself checking. Suppose you develop some symptom, just go ahead to the doctor, check yourself that if there is anything to you. So that will help you to keep yourself healthy. Now, how much time you should practice? There are 24 hours in the day, 1 hour you practice yoga. If you practice yoga, there is no disease, you will be healthy. If you are healthy, you will not spend money on medicines and doctors, so money will be saved. So you will be healthy and also wealthy. Understood? Some people from finance, they will not understand. So for them, I will explain in money wise. If you are earning 20,000 and spending 15,000 and saving 5,000 and practicing yoga regularly, if you are practicing yoga regularly, you will not have any illness. There's 5,000 rupees saved, so yearly 60,000, 10 years 6 lakhs, 20 years 12 lakhs. If you look back after 20 years of yoga practices, you will find that you are not having any illness, you are healthy, and you have got bank balance of 12 lakh rupees, so you are a wealthy man. If you are not practicing yoga, what will happen? Today you got headache, tomorrow you got loose motion. So when you get salary on first, you will keep 2,000 rupees aside for medical practice. And so you will save 3,000. So yearly 36,000, 10th year 3 lakh 60,000, 20 years 7 lakh 20,000. Suppose you get headache tomorrow, lose motion day after tomorrow, fever, something like that keeps on coming. And at the end of 20 years, suppose some big disease comes and hits you like heart attack, whatever money you have saved will be spent for the treatment and you will be bankrupt, a lot of money as well as health. And if you want to avoid this, you try to practice yoga. Now, so many people, they say, why you are doing all these things? If you have got money, you can buy everything in the world with the help of money. So can you buy everything? You can buy best of the bed and bedroom with the help of money, but not the sleep. You can buy best of the food with the help of money. You can order for intercontinental, continental, whatever you like, but you cannot buy the hunger with the help of money. You can buy best of the books, but not the wisdom. You can buy best of the medicine. Suppose a millionaire person, if I tell him that this is a tablet you have to take one every day and the cost of one tablet is 1 lakh rupees. He said, no problem, send 100 tablets. But still, you will not be able to give him health. So you cannot buy health with the help of money. And lastly, I add, you can buy everything, but not the time. समय चला जा रहा है. आज का दिन निकला, शाम हो गई, रात हो गया, मेरा 10 बजेगा, रात का आज का दिन खत्म हो जाएगा. वीक खत्म हो गया, मंथ खत्म हो गया, साल गया, शतक गया, नया सहस्त्र गया. और नए सहस्त्र के क्या प्रॉब्लम्स है? द मॉडर्न लाइफस्टाइल डिसऑर्डर्स वी हैव सीन एंड हाउ टू गेट rid of it, that also we thought of it. So utilize the time, because एक बार समय गया तो वापस आता नहीं है. And cultivate good habits. See the word habit itself. One of the word habit, HABIT. Remove H, a bit remains, means still habit is there. Remove A, bit remains, means still his habit is not gone. Remove B, it remains, means still he goes to the hiding place and smoke a cigarette and do anything, habit remains. Means once you get into the bad habit, you cannot get rid of it. So try to cultivate good habits. Try to practice yoga regularly. If you are practicing yoga regularly, it will act as a preventive. You will not get heart attack. If you have got any mild symptom, you can use it as a curative. Or if you have undergone some investigations and proved to be a case of heart attack, you can start practicing yoga under the expert yoga teacher so that you can prevent the further complication and you can keep yourself healthy. So I think that is sufficient for today. If any questions, we can devote some 5 to 10 minutes. Thank you very much.
Thank you, sir. Thank you very much, sir. Thank you very much for your time, your precious time. So before going for the questions, I would like all of you, as a sign of gratitude, there's a link on the chat where you can just put your feedback, comments. So I request all of you, please take 2 minutes of your time before sir just has a break also. And once again, sir, thank you very much for this beautiful webinar on the heart and how to keep the heart healthy through yoga. I think the chat, it has come, the message has come on the chat. I'll just put it now. It is already there, but still. Yeah, it has come on the chat. So please immediately can वो link पे जाके आप quickly आपका जो भी है, not on the chat box, please on that link, please on the link के ऊपर करिए तो डॉक्टर फाटक सर को मिलेगा. On the link chat दिया है, chat पे एक link दिया है, उस पे जाइए सब लोग please, just 2 minutes and quickly we'll go for the question. And before going for the question, let me tell you there is an important webinar on Friday on the behavior of children and how stressful they are going today's modern life, and also along with them the parents. So we are having a expertise coming there on Friday, so please join the session on Friday also. It's in the evening at 8 o'clock, and we also conduct meditation sessions morning, evening, and a lot of workshops. So be in touch with us all the time. Quickly, I hope if everybody has done it, please make a thumbs up quickly on the link. I hope everybody got the link. Link मिल गया आप लोगों को. Just make a thumbs up and I will stop the sharing. Quickly डालिए please. So अगर डॉक्टर जी हॉस्पिटल में काम करते ना, अभी 1.5 घंटे के लिए I think लाखों रुपया कमा सकते थे. But still he is doing it for a very noble cause for all of us. So a gratitude, as a gratitude, please. And you also know it will create a lot of social awareness also for all of us, you know, especially for Dr. Satish Pathak. So quickly, just another 1 minute and we'll go for the question answer session. If they have done, please put the reaction of that. Raise your hand up once you're finished. And we can take the question answer session now. So those who have finished can ask the questions to Dr. Sir or Pathak Sir. He's here. Please keep your videos on while asking the question. कोई प्रश्न है तो पूछ सकते हैं अभी. Chat में. Somebody was asking about Lahu Lahiri. What is Lahu Lahiri in the chat box?
Lagu Lahari, as you practice Omkar, I will just show you. Then the Omkar is practiced in succession. So routinely how you practice it is like this. Again you breathe in. Now this is a normal practice of doing Omkar. In Lagu Lahari, what you do, you breathe in one, and in one breath only, you do the Omkar in succession. I will just show you how it is done. Like that you have to do in 3 to 4 sets. That is Lagu Lahari.
Excuse me, sir. Yes, sir. In the exercise science, like the way we do deal the heart patients, like we target the MHR, then we set the THR, the target heart rate, and slowly we do the aerobic exercise. And try to increase the heart rate and meet the target heart rate and improve accordingly to improve the cardiorespiratory endurance. So is that process also effective, or we should go for this yogic approach only?
I think I will be in favor of yogic approach, because by doing exercise way, suppose your body or your heart is not capable. That's why in one simple word I have told, it is like a whipping a tired horse. You don't know how much that horse is tired. So similarly, you don't know how much the heart is weak or something. And if you try to give him by putting that markers and all that, you may stop it at the time. Suppose now his pulse rate has gone up to this, so that is the limit. So after that, he will not do exercise. But till that time, you are forcing him to do that, na? So that is what I think, that first at least 6 months you should not venture in this type of practice.
Good evening, sir.
Good evening.
Sir, very nice session. But my question is, whatever
Okay.
you have nowadays, whatever you have said, it is very. You have put it very simplistically and nicely in that. But whatever you have said, we all have listened to many seminars and all these things. But खाली सुनते हैं लोग. But मतलब जानते सब हैं, लेकिन प्रॉब्लम इज मानता कुछ.
करते नहीं है. हाँ,
Yes.
तो अभी हमारा प्रयास यही है कि जैसा अभी देखो टीवी पे ऐड आती है, ले बहुत अच्छा है, ले बहुत अच्छा है, कुरकुरे बहुत अच्छा है, तो बच्चा तुम्हारा क्या बोलता है, मुझे कुरकुरे चाहिए. क्यों बार बार उसके सर के ऊपर हैमर क्या है कि कुरकुरे अच्छे, कुरकुरे अच्छे. वैसा ये हम हैमर करके आपको बताते, एक न दिन आप सुन लेंगे और करेंगे. दैट इज व्हाट वी एक्सपेक्ट फॉर. हम हमारी कोशिश जारी रखते हैं. मराठी समझते हैं क्या? मराठी में एक कहावत है, सोनाराने फुंकली नळी इकडून तिकडून वारे गेले. वो गोल्डस्मिथ रहता है ना, तो हम ये कान से सुनते, वो कान से छोड़ देते हैं. लेकिन बार बार सुन के कभी तो थोड़ा सा नीचे परकोलेट हो जाएगा तो देखेंगे. दैट इज व्हाट आवर एम इज.
सर माझे 2 प्रश्न आहेत. हॅलो,
बोला.
हा, पहिला प्रश्न असा आहे की ज्या इन्व्हर्जन पोस्चर आहे, म्हणजे शीर्षासन, सर्वांगासन, त्यानं आपल्याला स्टँड बाय सिस्टीम निर्माण होते का आपल्या हार्टला? पहिला प्रश्न. दुसरा प्रश्न असा आहे की थोडासा म्हणजे कंट्रोवर्सी आहे की आयुर्वेद सांगते की तुम्ही तेल तूप खा आणि ॲलोपॅथी सांगते खाऊ नका, त्यानं कोलेस्ट्रॉल वाढेल.
आयुर्वेद सांगतात
तर म्हणजे ह्याच्याबद्दल स्पष्टीकरण दिलं तर बरं पडेल.
तेल तूप का सांगतं, तर तेल तूप कुठलं, तर तूप जे आहे ते प्युअर गाईचं तूप, आणि तेल जे आहे ते घाणीचं तेल. आता आपल्याकडे जे तेल मिळतं ते सुपर काय त्याचं नाव,
पुफा
नाही ते काय,
रिफाइंड ऑइल.
रिफाइंड, सुपर रिफाइंड. सो इफ यू स्टडी वाघभट, त्याच्यामध्ये असं त्यांनी दिलेलं आहे की तेलाचा जितका तिखटपणा जास्त, तितकं त्याचं व्हॅल्यू जास्त चांगली. आणि त्यांनी त्याच्यात ते दिलेलं होतं की पूर्वीच्या काळी हार्ट अटॅक हा प्रकार होता का, किती प्रमाणात होता, आजकालच्या प्रमाणात होता का, नव्हता. तेव्हा ते घाणीचं तेल वापरत होते, त्याच्यामुळे त्यांना सगळ्याच्यापासून प्रोटेक्शन मिळत होतं. पण आजकाल जे फाईन, सुपर फाईन आलंय, त्याच्यामुळे सगळे हे घटक निघून जातात जे तुमच्या बॉडीला आवश्यक आहे, पोषक आहे. म्हणून आयुर्वेदाने सांगितलं तेल खा, तूप खा, तर ते बरोबर आहे. पण आम्ही जे मॉडर्न ॲलोपॅथीचे वापरतो, सुपर फाईन आणि फाईन, तर ते त्याची व्हॅल्यू 0 आहे. त्याच्यामुळे ते डॉक्टर कन्क्लुजन आहे, तर म्हणून सांगतात तेल तूप खाऊ नका. आणि इन्व्हर्टेड पोझिशन मध्ये एक तर हार्ट अटॅकच्या पेशंटला इन्व्हर्टेड पोझिशन करणंच अवघड आहे, कारण ते इट इज व्हेरी हार्मफुल फॉर हिम. सो हार्ट अटॅक मध्ये त्याचा काही विचार करायची गरज नाही.
प्रिव्हेंटिव्ह जर आपण म्हणजे खूप वर्षापासून करत असू तर हार्ट अटॅकची शक्यता कमी होते का, असं मला म्हणायचं.
जर तुम्ही खूप वर्षापासून योगाचा अभ्यास करत असलात तर तुम्ही इन्व्हर्टेड पोझिस करू शकता. त्याचे बेनिफिट तुम्हाला जे योगामुळे मिळतात ते मिळतील. स्पेसिफिकली हार्टसाठी असं काही होणार नाही. यू विल नॉट गेट हार्ट अटॅक बिकॉज इट हॅज इम्प्रूव्ड द फंक्शनिंग ऑफ ऑल सिस्टम्स ऑफ युअर बॉडी.
धन्यवाद सर.
ओके.